Good morning, good afternoon, good evening to all our participants from different parts of the globe. Welcome to Nasco Healthcare PCS webinar on ALEX, AXEL, Spark, and Flex. I'm Manan Kalia from Nasco Healthcare, who's the director for Middle East, Africa, and South Asia. And along with me, I have Nick Stoic, who's the VP of Sales at PCS. Uh, this session will be recorded, and if you have any questions, please feel free to type in the chat section. We will answer them during the webinar. So take it over, Nick.
Thank you, Manan. And hello, everyone. And thank you for joining us for this PCS product overview. As Manan indicated, I am the VP of Sales for PCS. A little bit of background on me. I have been in the simulation industry for close to 10 years now, and I've been with PCS for about three of those. So we've got a lot to cover today. So I figure we can go ahead and kick things off with Axel and Alex. And as Manon indicated, we'll be covering three different products. So after each kind of different section, we'll have time for questions. So as you come up with questions during the presentation, feel free to type them into chat and we can cover them at the end of each section. So without further ado, we will move on to Axel and Alex. So sitting to my left here is Axel. And Axel is a mid fidelity patient simulator. So Axel really provides to the simulation market everything that you would expect from a mid fidelity patient simulator. So, right off the bat here, you have palpable pulses. So, you have carotid pulses, you have radial pulses, you have pedal pulses that are dynamic to the presented case. So, those can be adjusted, of course. Now, you also have the ability to listen to anterior heart, lung, and bowel sounds, and that goes as well for posterior lung sounds. Now, the way that auscultation works with Axel is you have this smart scope. And the way that the smart scope works is that it matches up with RFID tags on Axel, so it's able to tell basically where this is positioned and then play the corresponding sound back. Now you'll notice here with this little device, there is the spot to put a stethoscope into, and you can use practically any stethoscope. So the one that you're most familiar with, you can use. But then, of course, as well, we provide one with Axel and Alex. So that is auscultation and sounds. You're also, of course, able to measure blood pressure. So you have bilateral blood pressure that syncs up with the smart scope to listen to those carot cough sounds, and then it will present the blood pressure on the presented case. Also, you'll see in a bit here when we start up a case on Axel that we have chest rise and fall. So you will see the breathing actually taking place as you would expect from a mid fidelity patient simulator. Also unique to Axel and Alex is going to be the iris cam. So the iris cam is a unique functionality that actually puts a camera in the eye of Axel and Alex. So you can really capture the patient's perspective of what's happening during a simulation. And that's beneficial for a couple of different ways. The first of which is if a simulation center does not have a traditional kind of audiovisual debriefing system, the iris cam will actually integrate into the Axel software so that when you go back and review a simulation session, you can actually see a recording of everything that happened during that session and debrief it with the team. Obviously, since the camera is built into Alex's or Axel's eye, you're also getting that patient perspective. So you can see really whether or not the team members that are running through a simulation were paying attention to the patient, or just kind of going through the motions and not, giving them that kind of emotional support, if you will. And then new to Axel is our model driven physiology and drug treatments. So with Axel now, you have a complete modeled physiology, which allows for participants in a simulation to administer a drug treatment to Axel and then automatically have the physiology react without having to have a simulation technician kind of drive that physiology in a sense. And I'll demonstrate that in just a moment. And then finally, I just wanted to touch on one of the unique aspects of Alex, and that is going to be the speech interactions. So you can actually, of course, ask the questions to Alex, and then he'll respond back with an appropriate response. So, what I'm going to do now is shift over to our PCS software platform here and kind of go over a brief demonstration on how a simulation with Alex would run. So we have our Alex simulator here, Alex 269. We can see that he's ready to start. So I'll go ahead and click on start here, and then I'll choose the patient case that we want to run through. I'm just going to demonstrate this Alex Adams case, and it's kind of our general healthy patient. Then you can also see we have the option down here to record video. So if we wanted to record video off of that iris cam, we would just check that box here. I'll go ahead and click start, and the patient case will begin. Might not be evident, but you can perhaps see Alex's chest is also now starting to rise and fall based on his respiratory rate. All right, so once you're logged in and the simulation has begun, the first thing that's going to show up is the vitals monitor. Now, the vitals monitor can be, of course, exported to a secondary display. So if you didn't want to present all of this information to the simulation, the group that's running through the simulation, you can export that to an external display and just have this vitals monitor here. From a simulationist perspective, you can click on all of these vital sections, whether that's heart rate, SpO2 level, and adjust those levels to be at what you wanted them to be. If you're kind of simulating an event during the simulation where, let's say, the SpO2 level drops, you can type that in. Let's say we want to drop it to 92. And then you also, of course, can say, okay, we want this to occur over 60 seconds. Once you check on that, you'll see the SpO2 levels are going to decrease and an arrow trending downward over that 60 seconds until we reach that 92% level of SpO2. Now, let's see. We also have the ability to change these waveforms if you wanted to. So if you wanted to simulate different types of cardiac conditions, you can select those through a predetermined list here. And that goes for all of these different vital signs. Now I'm going to scroll down a little bit here. I'm going to skip over the team space for now because we'll go over that in a little bit. But you'll also see there's a section for sounds. So you have the ability to dynamically change the auscultation sounds during the simulation. And this is nice if you want for students to be able to hear different types of auscultation sounds. We have a different library of sounds for heart, lung, and bowel. And those can be changed on the fly. And then with Axel as well, you have the ability to kind of speak through the voice of the speaker since he doesn't talk for himself. So you can just check this little button here, and then the simulation technician, they can actually be speaking through the voice of Alex's or Axel's speakers so that you can portray him actually talking with the learners. And then if you did have Alex, you can actually type in text to speech if you wanted to and have him play back exactly what you type into this field here. And then finally, as we scroll down here in the video section, this is where you would actually see a live feed of the iris cam recording. So this will capture all of that video. And you can see here, since I didn't check on recording, it's obviously not recording. But even if it isn't recording, you could still get a live feed of what that patient perspective is going to be. And then finally, down here in the log section, this is going to record all of the events that take place during a simulation. So, for example, if I were to check Alex's pulse here, you can see the right radial pulse is checked. And that goes for everything. So every pulse points that are checked, every time that an auscultation sound is listened to, every time that a blood pressure is checked, every time that a drug treatment is administered, that's going to be recorded in the log section here. So that is the logs. Now I'm just going to scroll back up to the vital section here and then just do a quick show of how the model-driven physiology works. So once the model-driven physiology is enabled, there is a new ability over here to administer drug treatments. So you can see here, once I click on this little avatar with a syringe icon, we have the ability to administer a drug treatment. So we can select the treatment. Let's select just epinephrine for demonstration's sake. And you can see here now we have the ability to choose a different delivery method. So we have either intramuscular or IV. So if we choose IV in this example, and then come down here to the dosage, go ahead and click on, enter in 1, and then administer that. You can see here we immediately have the blood pressure spike up. We have the heart rate spike up. And that is all handled by that modeled physiology engine. And again, that's nice because it doesn't have to require the simulation technician on the back end to manually enter in what the correct physiology response would be for whatever drug treatments learners want to administer to their patient. It also, of course, takes into account the patient's age, the patient's weight, and then coming soon would be any kind of additional pre-existing conditions, such as if the patient had COPD or what have you. We also have the ability for electrotherapy. So you could virtually shock the patient back to life if that was necessary during a simulation. And then we also have a virtual 12-lead ECG. So you could have students actually place onto the mannequin, the leads, and then demonstrate what the result would be on a 12-lead ECG. It doesn't actually support real ECG machines. It's just a virtual ECG. And then finally, we're running out of time for this section here, but I just want to go over these two last sections here, and that is you have the ability for the checklist in the kind of facilitator administrative section. So ALEX does include a tablet. So as the simulation is ongoing, the facilitator can kind of be going through this checklist and checking off the items that the learners complete successfully. And then the other option here is this patient file. So you also have access to the patient file. So students can, read through this, see kind of the door notes of why the patient checked in and what their basic information is. So we are right at kind of the 15-minute mark, which was my goal here. Menon, was there any questions in the chat that we can answer?
Yes, Nick, there are a few questions. So
Okay.
these are all for you. So I will read them out and you can answer them one by one.
Okay, sounds good.
Okay. So can you stop and start video during the session?
Yes. So if you wanted to start and stop video, that is an option. You cannot, however, start and stop recording. The recording functionality is kind of an all or nothing. And that's selected at the beginning of the simulation with that little checkbox icon.
The second question is the iris cam still has a narrow field of view?
Yeah, so the iris cam is going to be the same camera that has been in Alex over the past couple of years. So there's no difference there. So the same kind of limitations still exist.
Is there any reason for that specific field of view being narrow?
Um, Honestly, I don't believe there's any specific reason. It was probably, at the time, the technology that we had available based on the size requirements for the camera. If we were to go back and kind of redesign that, I'm sure we could, use like a wide angle lens, but that's kind of, what it is at the moment.
In how many languages can Alex sound?
So Alex is going to be primarily from a speaking perspective, going to be trained on English. Now, there is the opportunity to use the text to speech functionality in, a wide array of different languages. There's not really any, language limitation there. And then we do offer the ability for learners, or I shouldn't say learners, I should say educators, to configure their Alex to be trained to a different language. And that will basically allow the for Alex to understand or transcribe the question that learners are asking, and then have that show up in the log. But then the facilitator would still have to either type in the question, text to speech, to have the response played back, because the AI and the machine learning, all of that kind of knowledge base is in English, and it hasn't been expanded to other languages. And at this point, there's no immediate plans to expand upon that. We do, however, offer power users in a sense to create their own custom patient cases, and they could edit the responses of Alex in a different language. But the caveat to that is going to be that the AI and the machine learning aspect of things is not going to be as strong as it is in English, and it's more of kind of a simple keyword matching rather than an algorithmic AI understanding. So I would caution going into depth with end users at first with that.
Can we revise the checklist?
Yes, the checklist is fully customizable. So in the patient editor, you can go in and edit it to your heart's content.
Can we create new drugs?
So there is a kind of a predetermined list of drugs that are, built into that modeled physiology framework. If there is a drug that you think should be added that isn't available, we're certainly open to looking into potentially adding that to the list. But it's not possible for end users to go in and add their own drugs to the list. And it would be a fairly complicated process if that was possible. But that is something that we control on our end.
So there are a few more questions. So I will answer a few and then I will give it back to you.
Okay.
So like another question is, can we add more cameras? So no, it comes with one standard camera. And if you would like, a center has their own learning management system, they can utilize those cameras to be integrated with Alex. Then what is the weight of Alex? Alex weighs around 20 kgs and it comes with its own bag. So you can easily store it and move it around from one place to another. Alex software requires upgrade and from time to time. Alex software is always internet connected. So it's always whenever an update comes in, so you will have the update automatically coming into the software as well. Uh, there's a good question. Can you show the camera function so that we can see the view? So can you show that?
That's a great question, and I would love to be able to do that. Unfortunately, I did not update my Alex in time for this event, so the camera is not working. But what I can do is once the event is over, I can take a screenshot essentially of what that camera view looks like from this exact perspective and send that out so everyone can kind of get an idea of what that looks like.
And also you can connect with your regional directors or your sales reps to get a demo done for Alex so they can show you the live view of the Alex camera function. Um, can you show us how the speech feature works live?
Yeah. So when you're ready to communicate with Alex, essentially what you'll do is you'll tap on the shoulder. You'll hear that beep. I didn't want to keep talking because then he'll try and respond to me. You'll hear that beep, and then you'll be able to start speaking with him. So I'll demonstrate just two quick questions, but then for the next section when we go over Spark, there'll be a lot more on kind of how that speech interaction works. But here's a few quick questions just speaking to Alex. Hello.
Hello, how are you?
I'm good. How are you?
I'm doing okay, thank you.
So I hope that you guys were able to hear that on your end. I'm not sure, we didn't test the audio for speaking with Alex, but you can see here if we scroll down in the logs, we can see everything that that I said with this little stethoscope icon here, and then everything that the patient responds with this little avatar icon here.
We have a lot of a lot of questions, so I'm not sure how much time we have.
Yeah,
uh,
I knew that that was going to be a potential issue. What we'll do is let's take a pause for a minute on the questions, and then what we'll do is we'll go over Spark and Flex, because I'm sure there's going to be more questions after that, and then we will hopefully I'll go quick, so we'll have some time at the end to answer more questions. All right. So what I'm going to do now is shift gears. I'm going to finish this simulation here. And then, of course, you can see here, the software is reminding me that Alex does need a software update. I will just take this time to mention it's very easy to do. All you need to do is, click on OK, start now. I generally recommend for users, if they can just leave their patient or their Alex online overnight, they can click on start now, and then that software update will roll through automatically for them. But what I'm going to do is actually log out of this account, log into a different account, and I thought this was a different account. Remind me later. Yep. Okay. And excuse me, demonstrate PCS Spark. So PCS Spark is a digital patient platform. So you can kind of think of PCS Spark as the digital sister to ALEX or AXEL, in that it is completely either screen based or virtual reality based. And allows for a learner or a group of learners to go through a simulation encounter virtually, kind of through distance learning. So what I'm going to do now is go through a quick kind of demonstration of what a simulation encounter looks like through PCS Spark. So I've just started up our Valerie Miller case here, and Valerie Miller has come into the clinic complaining of a headache. And the first thing that learners are going to see is going to be the lifeline. And the lifeline is really here for instruction for students who either have never used PCS Spark before, or they're, new learners and they don't know kind of exactly what types of questions they should be asking the patient. So it's going to give just some basic information of, make sure that you're speaking in a quiet environment, because a lot of the times if you have, going through this in a noisy environment, the microphone is going to be trying to pick up other conversations that might be happening in the background, and answering those. Also, if we scroll down, we'll also see it lists, some clinical interview objectives. In this case, we have the old carts mnemonic. So, just kind of giving some instruction on, what kind of questions should be asked, of the patient. And then, of course, similar to the checklist, all of this information is customizable. So if you wanted to use Spark for more of a testing environment, you didn't want to have this helpful information available, you could, customize it again, as much as you desire. So once the Lifeline information has been kind of digested, we can move over here to the video screen and we'll see our virtual patient sitting in front of us. So this is Valerie Miller. And she is right now in our clinic or our outpatient kind of environment. And we have a range of different, avatar appearances. So we have, ranging in age from 6 years old all the way up to 70 plus years old, different genders, different ethnicities. All of that are available in the kind of the avatar appearance. And then in terms of the clinic or the environments that the simulations can take place in, we, of course, have the clinic, but we also have a hospital environment. We have an ambulance environment. And then we also have a home environment as well to simulate, like, a home health call or a telehealth call, which are coming, increasingly prevalent. So, what I'm going to do now is kind of initiate this conversation with Valerie, see what's going on with her, and try and get to the bottom, of her condition. So, to do that, what I'm going to do is click on this little speech bubble icon here. We'll hear a beep similar to what we heard on Alex, and then I can go ahead, and start conversing with Valerie. Good morning.
Good morning to you as well.
My name is Dr. Nick, and I'll be taking care of you today.
Okay, thank you.
What's your name?
My name is Valerie Miller.
All right, Valerie, and what's your date of birth?
11th of April, 1983.
Thank you. And Valerie, what brings you in today?
I've been having these horrible headaches for the last few weeks.
Could you describe what the headaches feel like?
They feel sharp and at the same time, they're pounding.
And where are the headaches located?
It's usually on the right side, towards the front and top of my head.
Okay. How long do the headaches usually last for?
Every headache lasts anywhere from 1 to 2 hours.
Do you have a headache right now?
Yes, I have a mild headache right now. It is starting to go away.
Is there anything that helps with headaches?
Rest and time. I'll try to find a quiet, dark room and lie down until the headache goes away.
Okay. Is there anything that makes the headaches worse?
Everything I do seems to aggravate me when I have a headache.
Have you tried taking any medication for the headaches?
I've been taking extra strength Tylenol, but it's not helping.
How much Tylenol?
Usually 2 pills. But when the headache is really bad, I take 3 to 4 pills.
Have you noticed any changes in your vision?
Well, sometimes my vision gets blurry and sensitive to bright light during a headache. But there's no pain or any other issue.
Have you vomited at all?
In the past 2 weeks, yes. I vomited twice when the headaches first started, but not today or in the last week.
Have you ever had anything like this in the past?
I get headaches when I was a teenager, but I don't remember them ever being this bad, or this often.
So I'm just going to pause there for a moment and kind of, go over what we just saw there. The first of which is, if you've ever had a chance to work with Alex in the past and kind of ask questions of him, you'll see that our speech AI engine has really evolved dramatically over the past couple of years and has gotten extremely advanced in what it's, capable of understanding. To give you an idea, when we launched Spark about 2 years ago, there were, essentially 1,000 or so different, topic and responses that Valerie or the PCS engine could respond to. But with the, increasing number of users of Spark, we're now able to understand in the realm of upwards of 30,000 different questions and then have a relevant response based on the presented patient case. It's also important to indicate as well, thanks to the AI and the machine learning components of Spark, is that if a student or a learner, asks a question of the digital patient and it's not, an exact match of, what's kind of in our data set, that's where the AI, comes in and essentially tries to, fill in the gap and figure out, okay, based on these list of questions that we have, this is going to be the closest and what the correct response should be. And then everything that, I just asked of Valerie there, none of that was scripted. You can ask questions in any order. You can ask questions in, any kind of variation, and the system will be, able to respond. And then also with our, included patient cases, we include up to 16 different patient cases with Spark, and all of those can really be thought of as complete digital personas in a sense. So they have a full history of present illness that you can ask them about. They have a complete past medical history that you can ask them about, but they also have, like social history, risk factors, hobbies, things like that you can ask them. So, for example, we can ask Valerie here, what do you like to do for fun?
I do a lot with the kids. And I like to read and cook.
What are your kids' names?
My little boy Ethan is 10, and my little girl Sophia is 12 now.
So you can kind of get the idea there. So they really have, this, again, complete persona that, really tells the story of the presented patient case. And then also what's unique about that is since all of these patient cases are so fleshed out, they can be used across a range of different, medical specialties. So, they'd be relevant for nursing students. They'd be relevant for medical students, EMTs and that sort of thing. It's really not so much the case that changes as it is the scoring criteria that changes based on the type of student or the type of learner that is interacting with the digital patient. So I'm going to try and hurry this up here, but so once the conversation aspect of the encounter is complete, then we can trigger the health assessment or the physical exam. And to do that, we'll just click on this little button down here in the bottom right with the shirt on it. And then what's going to happen is Valerie will be standing up now, and we have access to 3 different icons. So the first icon, the eye icon here, this is going to be for, like a visual inspection. So if I click on this icon and then mouse over, let's say, the different parts of the face, you'll see that when I click on the eye, the correct tool shows up for looking closer at the eye. And then we also have, the eye exam findings. So in this case, you'll see there is kind of a text interpretation of what the findings are. But if we scroll down here in this window, we'll also, of course, see what the vasculature of the eye looks like. And then also, what kind of just a close-up look of the eye looks like. So this can be done for the eyes, the ears, the nose, the mouth, the skin, if there was like, a skin rash that was being presented. All of those can be, more closely visually inspected. And the neat thing that I haven't talked about yet as well is you do have the ability for facility or faculty to go in and create their own custom patient cases. And in the case of custom patient cases, you have the ability to change all of these findings, upload your own images, upload your own videos for the different findings. So that's what the eye button here is going to be for. We also have the ear button here, and this is going to be for auscultation. So if we move down to the chest here and hover our mouse over, you'll see that the stethoscope, automatically appears, and then I can click down, and based on, where I have that stethoscope placed, we'll be able to listen to heart sounds. And you'll see in the log message down there in the bottom right, what specific area that I'm listening to. So again, those sounds can be customized based on the case that's presented. It's the same library that is available for ALEX and AXEL, but a really great way to highlight to students different auscultation sounds for them to hear. And then finally, we have this hand tool down here at the bottom, and that's going to be more for, like a physical assessment, in the sense that, if you wanted to do like an abdominal exam, or if you wanted to check the pulses, you'd be able to do that with the hand tool here. Now, since this is a headache case, we don't have, kind of the physical exam, or I'm sorry, the abdominal exam findings set up. But, you could have that either shown in, kind of a text fashion, or you could, upload a video of what a correct abdominal exam would look like. So that's the physical exam functionality. Now, we also have the ability for, once the physical exam has kind of wrapped up, if, a medical student, kind of has a hunch on what they think the diagnosis would be, but, they want to request some additional information on, maybe some blood work or some medical imaging, you have the ability to come over here to the orders section and do just that. So we have a list here of the available orders that can be ordered for this patient. So let's say, I as a student wanted to take order a CT scan to see if there's anything going on in the brain with these headaches, and, also take a look at, what the blood work looks like. I would just select these two boxes, click on order selected, excuse me, and then immediately I would have access to, the CT scan, as well as the basic metabolic panel. So again, you can see here kind of a text interpretation from the radiologist, and then also, what the actual CT images look like. I have, of course, can go ahead, click over here on the basic metabolic panel, and you'll see here, I can figure out what the blood work would look like, and kind of help me in what my diagnosis as a med student might be. All right, so let's move right over here again. And the other thing that I just wanted to take a quick second to go over is our new TeamSpace multiplayer functionality. So with TeamSpace, we basically have the ability for multiple learners to connect to the same simulation session and work together on a patient encounter. So this is really great for, again, group learning in a distance type of setting, because you can have groups of students work together on a patient case, and they can communicate when they're connected over TeamSpace a number of different ways. The first of which could be through, chat message here. So you can have multiple learners kind of chatting about, okay, here's the next question we should ask, that type of thing. Or there's also audio support as well. So if I turn my microphone on, we could be talking in a group over TeamSpace. Now, when it comes to interacting with the virtual patient through TeamSpace, when a student clicks on this little speech bubble icon, that's going to mute everyone else in the group. And then everyone in the group, though, is going to hear what that student asks of Valerie, and then they're going to hear what Valerie responds with. Same goes for, with the physical assessment. Anytime that a student in the group, clicks on, let's say, the eye, for example, those eye findings are going to show up for everyone in the group as well. And then finally, with team spaces, what's really neat is we have what we refer to as learner attribution. So all of the team members in a group, any student that performs an action, whether that's a physical exam action or a speech interaction, that's going to be logged to that specific learner, so that a faculty member can, really go back and see what students were really participating in the activity, versus which were just kind of sitting back and letting the other group members kind of do all the work. So that's team space. We kind of already went over the vitals section in the log in ALEX and AXEL, so it's going to have similar functionality there. But since we're low on time, I won't go over that anymore. I'm just going to click stop here. And then once the simulation session has ended, students will get immediate and automated assessment on their performance. So we can see, how the students perform, what their overall score is. And if I scroll down further in the log section here as well, I can actually see with these little ribbon icons, what I was awarded credit for. And then again, one other thing I want to add too with this assessment is that you have the ability, of course, to customize the assessment scoring and set up different scoring profiles based on the type of learners that are running the simulation. So of course, a nursing student is going to have a different scoring criteria than a medical student. So that is PCS Spark. Manan, are there any questions that we can answer?
There were a few questions, so because you were pressing on time, so I took the liberty to answer them in the chat section.
Okay.
And they have been taken care of. If anybody has any other questions, they can type in and then we can answer that. So we just got a question now. How do we address body interact with Spark in front of the customer?
Well, I don't know if that's a question for me, because I'm going to be fairly biased and say that, a end user should be purchasing Spark and not Body Interact, because Spark is going to be able to do everything that Body Interact can do and more. If you want to take more of a balanced approach, Manan, I'll let you do that.
Okay, so basically for Spark and Body Interact, they go as a synergy. We can call that. In Spark, you have the capability to do communication in addition to the capability of having the physiological monitor, the patient monitor, so students can learn different waveforms and all of that. There are no interventions involved, so that's where the Body Interact comes in, and you can perform the main interventions on a Body Interact. So this is how you can differentiate, but a customer can have a combination of both in their center. A neutral approach.
Any other questions on Spark, Manan?
No, there's not any more questions. Yeah, there is a question which says, what's the difference between AXEL and an ALEX?
Yeah, so the difference between AXEL and ALEX is going to be that ALEX has that speech functionality. So the same speech functionality that we just saw here with Spark, AXEL is going to be able to have those same kind of conversations, right? But AXEL is a non-speaking simulator, so more of a traditional patient simulator in the sense, but you do have that ability to kind of have that walkie-talkie or that push-to-talk functionality, so you can still utilize the speaker in AXEL to have a facilitator kind of speak as the patient, if you will.
And then we have another question. Will Spark have an yearly subscription model?
Yes. So Spark is a subscription-based software service, and it is based on the level. So there's 3 different tiers. So there's a kind of a base platform fee and then a learner fee, and that kind of combines to be the total subscription price.
Then 2 good questions are there, which I think we need to answer them. How many students can operate Spark at a time?
So there can be up to 6 learners connected to like a team space multiplayer session. So that's kind of the cap on the number of learners during a session. But then, when it comes to concurrent users that are all kind of running their own independent simulation sessions, there is no limit per se.
Okay. The other good question is, can you upgrade Axel to Alex?
Yeah, that is a good question. And from a software standpoint, I don't see why it wouldn't be possible. I think we would have to talk because I don't know if there's pricing or such for that within NASCO's system. So that might be something that Lee and I need to talk about.
Okay. Then the cost, there's a question related to cost. So cost, you can always reach out to your regional distributor, directors, salesperson to get more information about the price. We will not be discussing the price on this platform.
Excellent. All right. So we've got 13 more minutes. I just want to take a little bit of time to go over Flex with everyone, and then we can go over whatever questions we have with what remaining time we have. So finally, PCS Flex. So as you can see here, if you haven't noticed, I've been wearing PCS Flex since the beginning of this presentation. And PCS Flex is a new product that we launched a year ago, which is a wearable simulator. So it's unique in the sense that you can put Flex either on a standardized patient, so like a human patient, such as myself, or you could put it on a mannequin, a low fidelity mannequin that doesn't really have any functionality other than taking up a body, if you will. So it's flexible in that use case. So what does Flex enable from a simulation standpoint? Well, number one, it's going to be able to add physiology to your simulations. So in the case of a low fidelity mannequin, that's just a plastic mannequin, you have the ability to add pulse points. So there is pulse points in the radial, so I can check my pulses radial or carotid. And that those pulse points are going to be dynamic in the sense that, if you wanted to simulate tachycardia, you can increase the pulse points of those dramatically. So those are completely customizable. You also have the ability to add auscultation. So with auscultation, you can add, obviously lung, heart, and bowel sounds to your simulation. Included with the Flex package is going to be the smart scope. So it's a little bit different from the scope that ALEX comes with, in that it's just one complete piece, and then you would place it on either the mannequin or the person's chest that's wearing the Flex shirt, and then they would be able to listen to different heart sounds, lung sounds, bowel sounds based on the presented patient case. From a physiology standpoint as well, you also have access to that PCS AI platform that provides the vitals monitor and that model-driven physiology. So all of that is possible with Flex as well. And then it also adds wireless AV. So it provides or it includes a lightweight camera that is wireless and can be placed pretty much anywhere in the room that the simulation is happening. And that will, similar to how the iris cam works, kind of draw in that camera feed and allow for a debrief of the simulation session after the simulation has taken place. So the PCS AI platform, that's everything that we've seen thus far. So it runs on the same software that ALEX and Spark run on. You also have the ability to add the PCS speech engine. So if you wanted to, for example, turn your low fidelity mannequin into a patient communication simulator, you could do so with Spark, with Flex. As it also includes a microphone and a speaker that you could place near the low fidelity mannequin to enable those kind of speech interactions. And then finally, with Flex, we also have a really neat functionality for standardized patients in PCS Transcribe. So if you're using Flex with standardized patients, you can actually transcribe the entire encounter. So as you're kind of reviewing the standardized patient encounter with a learner, you can go through and actually see everything exactly what the learner said and exactly everything that the standardized patient responded with. And then everything with Flex is essentially controlled with this little processing box here, which is just worn around the belt, the included belt during a simulation. So that is a quick overview of Flex. And kind of the last thing that I wanted to mention here at the end is, really to think of PCS as, a software platform. And what's really unique about it is pretty much every patient case that we witnessed here today can be run across AXEL, ALEX, Spark, and Flex. And you can really take the kind of the learner journey in a sense from they can practice on a case with Spark at home using practically any device that they have. They can go into the simulation lab and really practice hands-on with that case, that same case on an ALEX or an AXEL mannequin. And then, as kind of a graduate OSCE type of exam where they're interacting with a standardized patient, you could run through that same case with a standardized patient wearing a Flex shirt and have those same auscultation or physiology that you would expect from that case. So we have about 7 minutes left, and we can just open it up to whatever questions are remaining.
So we have some good questions. So I will go with the first one. Do you have any emergency cases, Nick, like STEMI, etc.?
Yes. So just off the top of my head, we do actually have a STEMI case for Spark. That is the only one that I know of off the top of my head, but we can definitely get everyone, a list of cases that are included with Spark, with ALEX and AXEL, and with Flex because it differs between the three different products.
How do we clean Flex? Using a laundry machine or something different?
Yeah, good question. So the Flex is, machine washable. So there is within the Flex, there is the electronics that are kind of, a part of it are the wiring harness that controls the pulse points and such. So that's easy to remove, and then you can take the Flex, put it in the laundry machine, and then wash it in cold water. Included with every Flex is, of course, the washing instructions. So it'll show you how to do all of that. And then the RFID tags that are actually in the Flex shirt to pair up with the smart scope for auscultation. Those are machine washable as well. So those just stay in during the washing process.
Any pediatric applications or mannequins?
So no pediatric mannequins. However, we do have pediatric cases for Spark. We've got some really neat ones. The first of which is a 6-year-old girl who presents with an allergic reaction. And that case is unique in the sense that it also includes the mother in the room as well. So questions can be directed to either the mother or the daughter. And depending on, of course, who the question is asked of, the correct avatar, will respond with those questions. And then we also, in addition to the 6-year-old case, have a 11-year-old pediatric case, and that is a psychosomatic abdominal pain case. And that one is just, with the 11-year-old by herself.
We have received some requests for the next session, so it will be good to have some scenario creations also done in the next session, so which will be helpful for the sales process.
Sure.
So how many interface language?
Oh, for the interface, that is a good question, and I don't know off the top of my head, but I will take a note and we can get that exact list of what languages. Or let me just try one thing here, kind of. If I go to yeah, that might be something that's controlled on the back end. So I will check on that and get a response because I do know that we have a few different languages that the interface has been translated into.
Okay. For Spark, the modules that we offer, the scenarios, are they validated or they follow any medical protocol?
So they are validated in the sense that we have a clinical advisory board that reviews all of our included patient cases. So we have a clinical advisory board that includes MDs, nurses, and such. Of course, there's always the possibility of different standards of care through the different regions. So that's something to take into account.
So that's all the questions that we have. I think if anyone has any more, please feel free to type in now or contact the Nasco Healthcare representative so they can answer those questions for you. Yeah, we got another one. Okay, so they are requesting for more Flex software related webinars, live scenarios. So they have only seen you wearing it, so they would like to have some more of those scenarios to be shown.
Sure, yeah, we can try and figure something out for that in the future.
Okay, perfect. So I think we are done. I think we are directly right on time. There are no more questions. So I would like to thank everyone for attending the webinar today. And before you get off the call, make sure you follow us on LinkedIn, all the social media platforms, LinkedIn, Facebook, Twitter, and Instagram, so that you are always ready to answer all your questions because we post a lot of information there along with the videos. So this session will also be available on our YouTube channel. So this way you can also share the information with your customers and always be ready. Thank you.
Thank you, everyone. I really appreciate your time and thanks for joining.